Hi, I'm Kenny Anderson, Director of Multicultural Affairs for the City of Huntsville, and welcome to Impact. Each week we bring you information about interesting and informative things that we hope will be of benefit to you. We've talked about hospice before in this program, and we shared information that we thought was very important for people to begin having family conversations and community dialogue around. We're going to continue that conversation today with a couple of individuals who are going to provide some insight as to what's happening currently with regards to hospice in our local community. Lee Shore is Director of Business Development at Hospice Family Care. Welcome back to the broadcast.
Thank you for having me. It's been a minute, but I'm glad to be back and to share the updates on end-of-life care in our community.
It's great to have you back, and it has been a while, but of course, you know, we like to keep people coming back and provide great information for us.
Thank you.
You have with you Ernestine Gordon. She is with us today as an intake coordinator and RN at Hospice Family Care, and she's an associate minister with New Hope CPC. Welcome to our broadcast.
Thank you. It's good to be here.
It's good to have both of you here. Lee, first of all, tell people what Hospice Family Care is, because there's a lot of thinking out there about hospice. There's a lot of things being said about hospice. Basically, tell us what your agency provides.
Hospice Family Care is Madison County's only not-for-profit hospice. We partnered with Huntsville Hospital in 2013 to bring more comprehensive end-of-life care to our community. And hospice care is more of a philosophy. So it's a holistic approach to care when the focus of care needs to be focused more on comfort instead of cure. So we all know that one day, someday, that we are going to die. None of us really know when it is. So we at Hospice Family Care consider hospice to be a gift, because if a patient has been deemed by a physician that their life expectancy, if the disease takes its normal course, would be 6 months or less, then they have the option to elect hospice care. And hospice care comes in and not only cares for the individual's physical symptoms that are going on related to their disease process, but we also care for the spiritual well-being of the person, the emotional well-being, if there's any social needs that the person may have. So instead of looking at the patient as the patient, we try to stand back and no longer look at the tree or the disease, but look at the forest and see what is going on with this patient. And if we have half a year left to live, what do we want to do with that time? And make it the most important and impactful that it can be.
And you have said this in so many ways, that when a person is going through that journey, it's not just the person.
It is not just the person.
Family members, it's the community, it's the people that they may be employed by, it's the church family that they may be a part of. There are lots of people involved with multiple layers of complexities that you actually provide services and answers for through this holistic approach.
Absolutely, and that's another difference about hospice care. When you and your loved ones decide that curative treatment is no longer the best option for you and you want to focus on comfort cure, no longer is the patient our patient. The whole entire family unit and anyone touching that patient coming in and out of the home, we want to make sure that they're well educated on what's going on with the patient. We want to make sure that they are well loved and feel supportive. And even after the death of the patient, we follow those families and caregivers for 13 months to make sure that they are taken care of and all their bereavement needs are being met.
You know, it's interesting because every time I have a conversation with you or someone else about hospice, I either learn something else, I'm reminded about something, or I'm even more energized about why this makes so much sense to me. What you just said is so significant. I'm going to go back to it one more time. 13 months beyond the person's passing are probably even more critical than the time that the person was actually dealing with the situation, because most times when somebody's sick or dying or in a dire situation, you don't have time to grieve that loss. You don't have time to process certain kinds of things. It's after you have buried your loved one and after things have kind of quieted down a little bit in the world that internally people need things, and you're right there for them.
Absolutely. And so we make personal contact with all the families that are served by Hospice Family Care for that 13 months. We want to make sure we get through that first birthday, the first Christmas, make sure that they've thought of the things that they need to take care of, and provide them with assistance in a supportive role in any way we can. Not only do we do that with our families with the personal contact through our bereavement coordinator, we also offer support groups every Tuesday and Thursday night, as well as support groups at the Madison Senior Center and the Huntsville Senior Center. And those are for the community members at large. It doesn't have to be a hospice patient. It could be any sort of bereavement needs. So we really try to focus on our entire community, make sure, number one, that they're educated on end-of-life care. So when the time comes and they need to make an informed decision about their health care, they have the knowledge to do so. And then secondly, walk them through their process. And finally, make sure that they're well taken care of after the process.
Ernie, I'm a mental health professional by trade, and so I have known about hospice forever in my professional career, my academic career. And one of the things we used to always talk about was how we live in a death-denying society where people don't like to, as Lee said, talk about the idea that one of the most inevitable things of our lives we don't like to talk about. So inevitably, we're unprepared when it happens. We're suffering in silence when it happens. We're overwhelmed when it happens. And in many instances, from a cultural perspective, there's some communities that do not take advantage of services that are available. One of those communities happens to be our community, the African-American community. And the idea that we are less than 10%, is it? I heard a statistics at 8% that take advantage of hospice services, and I'm thinking that number should be more like 92% with the things that I know and see. Why is this such a big challenge for people in the Black community?
I think the people that I've spoken with about hospice services, they're afraid they give up hope. Because a lot of people have mentioned to me and said, well, I'm praying. If I feel like if I go into hospice services, I'm giving up on God. But that's not the case of it. Because when you can have hospice services and we are there for compassion and help you with the family members in the home, and we're there to help the whole family like Lee had just mentioned about, and you're not giving up hope. I said you don't ever give up hope. You keep praying. God is in charge of this thing, but we need to be in the home to help with the things that, we need. We always feel like we always like to take care of our own families. And we always been, raised to do that. We take care of ourselves. We don't need anybody else. But we need more education with that. And I like to work through my church and other churches to meet that need, to have more educational programs to explain the services, because if you don't know, you're afraid of it. Yeah. Like used to be a long time ago, I used to be afraid of hospice. When I heard the hospice, I say, oh, that's somebody gonna die. But that's not the case, because we can come in there and sometimes make your life better and enjoy the quality of life that you have. And we need a lot of education. That's what I'm thinking we need to do.
That's so important. And the things you're saying, just the whole notion from a cultural perspective, the Black family has a strong familial bond. Yeah. It is sometimes perceived as rejection, betrayal. If you you turn the care of your loved one over to someone else. We think about it from that spiritual perspective that, I'm not going to give up on God, and, I'm somehow denying God's power and authority in my life. And, the thing that people need to really think about is, as I remind people all the time, if I have appendicitis and my appendix ruptures, I'm going to pray, Lee. Yeah. But then I'm going to call 911.
Yes.
I'm going to find a doctor who's been trained and able to provide the services that I need to be able to fix me and get me back in health. And I see it the same way with hospice in a similar way. Now, I don't think you just say that to people like you're saying, Ernie. You got to educate people. But I think it's the same basic thing, that there are services out there that we sometimes don't take advantage of because of certain ways that we perceive life, certain cultural trends, and certain things that we've basically told ourselves you just don't do. And we're denying ourselves some valuable services. In fact, Lee, Ernie talked about hospice being a death sentence in some people's minds. Do people sometimes live beyond that 6-month window?
Absolutely. And that is one thing that is great about hospice, is that we are managing all the care of the patient. So right now, if you have a heart problem, you're going to go see your cardiologist, lung pulmonologist, and whatever. But when hospice comes in, we're looking at the whole person and the whole picture. And in doing so, we can do better management of medications, emotional support. And sometimes when we get those things under control, they actually live longer than 6 months, and we have hospice graduates all the time.
Wow.
And what we like to tell our families, off of what Ernie said, is that we don't want to lead, we don't want to follow, we want to walk alongside the path that you're on. And so, Kenny, you're going to care for your family member better than I can or better than Ernie can, but we want to provide the best support, love, and education so you can do that well, and make sure that you're taken care of too, because if you're not taken care of, you're not going to take the best care of your loved one. And so that's really what the whole idea of hospice is to empower those. And often that's a misconception that we're going to come in and take over. No, we want to empower the caregiver and provide that support.
That's a great way to talk about it, and that educational process as well. It's about empowering the person And it's also about giving them a sense of accountability with regards to that process and providing the support to anchor them through that very difficult and challenging journey. What are the eligibility requirements for hospice?
So Medicare says that a hospice provider must certify from a physician that the person has a prognosis of 6 months or less if the disease takes its normal course. Now, we all know that everybody's body's different and the disease might not take its terminal course and its normal course. And so Medicare lets us look at the whole picture of a person, so we do have to have some sort of terminal diagnosis. Congestive heart failure, COPD, cancer, Alzheimer's, dementia, any sort of life-limiting illness, there has to be a diagnosis. But we really step back and look at the whole picture. Do they have congestive heart failure and COPD, and they're not eating as much? Have they lost a lot of weight in 6 months? So we try to gather all of the information about the patient and what has led to this decline. And if the disease still runs its normal course, is the likelihood that they'll be here in 6 months or less probable? And if that's the case, then we bring them onto our services and present it to our medical director, and he certifies that that is the case as well. So automatically you're getting 2 physicians that agree that this is probably the likely path. You know, there's not a certain disease that you have to come onto hospice. Like I said, it's a really holistic approach, and we want to look at the whole patient and what all is going on with the patient: frequent hospitalizations, weight loss, increased need for assistance, and see what all is going on and what we can do to help.
And how's it paid for?
We bill Medicare and most private insurances and Medicaid, but being Madison County's only not-for-profit hospice, we are able at this point to take patients regardless of their insurance and regardless of their ability to pay.
Yeah, I think that's another thing. People need to just ask questions and find out what resources are available. Ernie, getting back to in the last few minutes that we have, this whole notion of how education is key. Hospice Family Care is available to the community, especially those demographics of our community who may have specific concerns and issues. I know that Hospice Family Care has led out an initiative to reach out to Black churches. This is something that will continue and hopefully grow. I'm happy to support that as well, and want to work alongside you all with that. Continue, I should say, to work alongside with you on that. If people want to get that kind of information, you're available to provide that for them, isn't that right?
That's correct. They can give us a call, and we can come out and make visits. I would like to get in the habit of going to the churches and speaking with, the pastors, and especially with the nurses guilds in different churches that they have, to give them that information so they can give it to their congregation. And I figure by getting the church and the pastor spreading the word, that's a good way to get all the information out to them. Yeah. And we'd be available anytime to come out and do that.
Right, and I think that this is also a great time to say, as I was talking about partnerships earlier, that I would hope that the leaders in the faith community would see themselves as allies in this process. Number one, educate themselves. Yeah. Find out about what hospice is, find out who's eligible and how it's paid for, taken care of, and what the process is all about, and then provide forums for educational opportunities in partnership with your agency or anyone else out there that's providing information about hospice. I just think that we live in a society where there's too much information for people to suffer in silence or to die without the opportunity to gain access to things that are available to them. So hopefully people will have heard this and they will respond to this call. Lee, once again, thank you for being here and sharing this great information. If people want to find out more information about hospice, again, how would they go about doing that?
They are welcome to call our office at 256-650-1212. They'll have the pleasure of probably speaking with Ernestine, and so she can give them all the information that they want to know. We have a Facebook page, Hospice Family Care, and as well as a website, hospicefamilycare.org.
Outstanding. Lee Shaw is Director of Business Development, and Ernestine Gordon, Ernie, is Intake Coordinator and an RN and Associate Minister at New Hope CPC. Thank you for being here with us today.
Thank you for having us here today. It's been a pleasure.
All right. Ladies, thank you so much for a great conversation.
Thank you.
I want to thank you for being a part of our conversation as well. And as always, we appreciate you taking time to spend with us to learn something that's going on in our community and ways in which you can perhaps make the community a better place to live. I want to make a special appeal today to those that are listening. If you're a member of the faith community, perhaps you're a leader, perhaps you're a member, perhaps you're an auxiliary leader, or in some churches they're called committees or department heads or chairs. please reach out to Hospice Family Care. And when they reach out to you, please be responsive to them reaching out, because this is a partnership that needs to happen in our community. We want people, your members, to get the services that are available to them. Let them make the choice as to whether or not this is the right option for them. In the same way that everything is about choices. Please help us with this process today. I hope that you've enjoyed the show that you watch. You can see a copy of this show on our Facebook page, which is Impact with Kenny Anderson. And as always, thank you for being a part of our show. We'll talk to you again soon.